Hi everyone, and thanks for joining us. My name's Dr. Tanya Cubitt and I'm the Consultant Nutritionist to Highgain. We're here today to talk about the most common, disabling and painful disease in horses, laminitis. We'll discover what laminitis is, what it looks like in the horse, and further investigate digestive and metabolic causes. We've all heard the term laminitis in horses before. Some of you may have had a horse that suffered from laminitis. It's really quite a complex disease to understand, and that's exactly why we're here to discuss it. By the end of this video, you'll have a better understanding of what happens in the horse's body, especially in the horse's hooves, and the many different causes that can trigger this terrible disease. Okay, so let's start with the term laminitis. It literally means an inflammation of the laminae of the horse's foot. Laminae refer to the insensitive and sensitive tissue that's located between your horse's hoof wall and the coffin bone. The laminae are tiny finger-like structures that interlock and secure the coffin bone to the hoof wall and keep the bone in place. If the blood flow to these laminae is disrupted, inflammation can occur that weakens these tiny structures and interferes with the wall-to-bone bond, making the laminae unable to hold the coffin bone in place. Hi everyone, and thank you for joining us. My name is Dr. Tanya Cubitt and I'm the Consultant Nutritionist to Highgain. With me is Master Farrier John Pittard, our demonstration horse Doc, and horse handler Jennifer. We're here today to talk about the most common, disabling and painful disease in horses, laminitis. We will explain the early signs of laminitis and first aid treatment. Are you worried your horse may suffer from laminitis, or are you unsure about how to detect the early signs of this painful disease? Master Farrier John Pittard will show you hands-on first aid practices that will help to relieve some of the pain experienced in the early onset of laminitis.
If your farrier or veterinarian cannot attend promptly on realisation of the condition, I suggest as the preference the use of a sole support product which covers the whole sole and frog of the hoof, which you can attach with elastoplast. Alternatively, without the benefit of a sole support, I suggest you could use the actual thickness of a half roll of elastoplast, and by laying the roll down the hoof, cover the frog, placing it from heel to toe, not across the frog. And then use a full roll of elastoplast or Coflex to wrap the whole hoof up and secure the supporting roll or tape in place. This provides your horse with some immediate relief. Both these procedures will not cause any harm to your horse, even on examination the condition